Individual placement support, or IPS, is an evidence-based model of employment and vocational support that we provide in the early intervention psychosis team. IPS is one-to-one employment and vocational support, and it's based around people's aims and their goals in terms of paid employment or volunteering or education or getting back into the workplace. And it involves working with people on a one-to-one basis to support them to achieve those goals.
So IPS can be received by basically speaking to your care coordinator or any of the nursing team that you're working with. Each team works differently. Some might do a referral form, some might just do word of mouth. Once you've been put forward, the IPS worker will meet with you and set a plan to go through a plan of goals. So that could be, I want to get into a college course, I want to get into full-time work, part-time work, or I'm currently off sick from work, I want to prepare to going back to work. So it'll be looking at the individual's roles and what they want moving forward, and then set a plan on how often they're going to meet and what the end goal is. So since I've worked in the team, I've seen the massive benefits to that IPS. We used to use, sort of an older technique before, and I think maybe because most of us are nursing trained or we go into mental health because that's our passion, we didn't have much of a knowledge on individual placement support and education and work. So it's something now the staff have been trained in, and since we've brought it into our team, we've seen massive successes. It's something that in our team, our numbers of people in employment have massively increased, but also people's well-being seems to have improved as well. And we've had people that out of work have been sort of quite chaotic, using substances, and then once we've been able to work with them to get into work, their relationships with their families have massively improved, their outcomes have massively improved, but actually their well-being has massively improved, and their relationships with their loved ones and stuff like that. But also, I always say to the people I work with, if I was to sit on my sofa and I didn't have any mental health difficulties for 6 months, or be stuck in my flat because I have no money to get out, my well-being, my how I feel in myself would feel, go down, and I would feel rubbish about myself. So it's in some ways, and throw in the mental health side as well, it's getting them out of that little rut that's happened and then moving forward.
The benefits of IPS is that there's a lot of evidence to suggest that being in employment and vocation is really positive towards people's mental health. It provides routine, it can provide motivation, it can give people an income and kind of help their self-esteem and feel good that they're kind of achieving their goals. That is the benefits of IPS.